Hi Tubesters, I thought I'd show you some of my favorite toning exercise for my arms because I'm determined to not have this hanging down as much as I can help it as I go through the weight loss journey. So I just thought I'd show you what I'm doing. Now I did these before surgery and I started back doing them just a few days after surgery with my doctor's blessing. Ask your doctor, but my understanding is so long as you are not doing something that's going to affect your core, the inner organs that are being stitched, you should be fine, to go, and also your incisions if there's any issues with that. But my incisions were fine and didn't have any issues with doing the arm exercises. These aren't weights, it's TheraBands, and it has controlled motion. Shouldn't be affecting you to the point where you can't do it, so don't use that as an excuse. So here we go. These are TheraBands that I got for free on freecycle.org, but you can get them at many places for not too much money, probably under $10 or so, or certainly under $15. And so the first one that I do is, and this isn't necessarily in the order that I do them, but I wanted to show you all pretty quickly. This is a tricep extension, which I'm sure you're used to seeing in the gym and elsewhere. And this is a pretty tight TheraBand, and there's different lengths and strengths of these that you can use, but just for demonstration purposes I'll use this one. So all you do is you straighten out, you go from here, straighten out like that, and tighten your core right here as much as you can. Breathe from down here if you can. And there you have the triceps. I try to do 3 sets of 10, but I alternate these exercises each set. So, one set doing each one and then going back to the second set. Okay, at this level, and I'm using this, but you can also use, tie a knot right here and put it up over the door or in the side of the door, shut the door with the knot on the other side and the bands toward you, and you have the same effect. Or you can find other things maybe around the house or outside to work with, a tree or something like that. So be creative where you need to. Okay, so the next one works your mid-back and shoulders. You're just pulling back, and you want to get back to where you can feel, some tension here. And do that, and you're going to try to pinch like you're pinching a pencil that's lined up along your spine between your shoulder blades. And again, engage your core and breathe. I have to remind myself of that, so I'm kind of talking to myself about that. Okay, so that's that one. Then while you're at this level, or you can come back to this level, while I'm at this level so I can show you, there's a couple other variations of things for your shoulders. One is doing T. I always want to call this the iron cross because it reminds me of the gymnast. And it's a little hard to do with short bands like this. It's easier if you have longer bands. But I'm going to do it with maybe not so great form, because I need to get some longer bands. But you're just going, out to a T, where your arms are like that. Then the other variation of this, I call the W, or the touchdown signal. You're going like this and then up so that your arms are forming like a W, or if a ref is doing that for touchdown. So you're just going back and up and down and back. And that's the W. Then I have this, or you can use TheraBands, or whatever you want to do, but biceps. Again, pretty simple. And so engage the core on that too. So there you have 5 different exercises using your arms, your upper arms especially, and that has helped me lose 1.5 inches off of my upper arm in 1 month, the first month after surgery. and I hope to keep on toning it up. I can see differences already, though I think only I can see tell that, but hopefully in the future other people will be able to see the difference too. But, you know, really this is our own personal journey, and this is for me, and I'm real happy with it. So thank you, and you have a great day.